It is called benign prostatic hyperplasia, commonly known as BPH or enlarged prostate, a disease affecting more than 90% of men between the ages of 45 and 80. So ladies, if your husband falls in that age group, chances are he either has or will deal with this medical condition. So in this edition of Health Matters, joining us to discuss this all too common problem is Dr. Robert Pugach, Medical Director at Southern California's Pacific Coast Urology Medical Center. Also with us this morning, a BPH patient, Robert Munson, here to share his perspective for all the husbands and wives out there. Welcome to the both of you.
Thank you.
Thank you, Daniel.
I really appreciate you, Robert, coming on to share your story, and I do want to hear that in just a moment. Doctor, I want to start with you because give us a definition. What is BPH?
It's benign prostate growth, and there are two parts to that. The first is during puberty, and the second is between the ages of 25 and 35, when progressive prostate growth leads to obstruction or blockage of urine flow, giving us the common symptoms of a weak urine stream, frequent urination, nighttime urination, and urgent urination.
Mm-hmm. And these are things I've heard a lot about. What I haven't heard a lot about are some of these traditionally prescribed treatments. For our audience out there, tell us very quickly what's been that traditional method of treatment.
It can be surgery, it can be medication, and medication is by far the most commonly used therapy. Unfortunately, half of men don't respond to medication, and of the half who do, many get only a partial response, so the symptoms and problems continue.
Okay, Robert, now you took a trip. You have an interesting story about a trip you took. You live in California. You were traveling up to Washington State. If you don't mind sharing with our audience how you knew during that trip that I might need some medical help here.
Yes, I think, being at 1,000-mile trip, I had even thoughts about it on the way, like how am I going to make it from place to place? So you're always drinking a liquid or something. So it become every hour we'd have to stop.
You were stopping every hour?
Every hour. And when I got done with this trip, I was ready for something. And I had tried prescription drugs and tried that, and it never really helped. So that led me to Dr. Pugach.
You know, and it's interesting because, and I don't know how comfortable you feel saying this, but I know your wife who's here this morning, she was so frustrated. What did she say to you?
Well, she handed me a Starbucks cup and says, here, use this.
That's frustration, and we laugh about it, but really,
it
when you learned about the various treatment options that were out there, did you try that kind of prescription medication route first?
Yes.
Okay.
And it didn't work.
It didn't work?
No, it was 2 weeks maybe, and then it would be back to the same thing.
Mm-hmm. So let's talk about some of the other options out there, doctor. Are these other options safe? And I know as a wife, I'm thinking, is it safe and is it going to be effective? It's got to be both.
Women and men are concerned about safety, and it's good to know that 15 years ago, the FDA approved these treatments in the U.S. And what we now do is direct either microwave energy or radio frequency energy precisely into the prostate to heat it and start a shrinkage process that goes on for many months. As that shrinkage occurs, there's less blockage, the symptoms start to resolve, and little by little, men get better and better, so the frequency, the nighttime urinating, the urgency all start to diminish. We can do those treatments in less than 30 minutes in the office now. Patients do not have to go into the hospital. And in my practice, those treatments are 2 to 3 times more effective than any medication anybody can take.
I was reading earlier about an independent survey that came out a few years back. I want you to tell me about that.
That survey said what many others have said, and that is that half of all men taking medication aren't happy with the results, 3/4 are looking for something better, and 2/3 of them would have an in-office treatment tomorrow if they knew it existed. The problem is most of them don't know they exist.
So but you knew, you found out by doing the research, I guess.
I found out, and then it led me to Dr. Pugach's office, and we made the decision, myself and my wife, and only a feeling of heat was the only thing I ever felt.
So it was not painful at all?
No. This has been 2 years now. I've had this procedure, and everything's going well.
Doctor, why should they consider certain non-surgical treatment for BPH?
There's just no reason to suffer symptoms anymore. And when medication doesn't work and somebody doesn't want surgery, a single 30-minute office treatment can lead to dramatic results and let men and their wives get a good night's sleep again.
Doctor, as always, great information. Thank you.
Thank you.
And if you'd like additional insight on BPH, please visit beatbph.com. That's beatbph.com. Oh, and you can also visit urologics.com and get social. Look us up on Facebook at The Balancing Act Fans. Share with us your story on BPH or anything related to today's topic. It's the social thing to do.